Welcome to ASWB MSW exam practice test. Our topic today is assessment and intervention planning. Use the link in the description to download the app on the App Store for free practice tests. Number 1. How many different focuses can social work assessment have? A. 3. B. 4. C. 5. D. 6. The answer is B. 4. Explanation. Each different aim of assessment has its own approach, namely intrapsychic dynamics, strengths, and problems; interpersonal dynamics, strengths, and problems; environmental strengths and problems; and the interaction and intersection of intrapsychic, interpersonal, and environmental factors. Number 2. Which component of psychosocial approach determines how different characteristics of client and client's important relationships interact to influence his or her total functioning? A. Dynamic. B. Etiological. C. Clinical. The answer is A. Dynamic. Explanation. Components include dynamic, determining how different characteristics of client and client's important relationships interact to influence his or her total functioning; etiological, determining the causative factors of the presenting problem and of the client's previous attempts to deal with it; clinical, determining articulation of the client's functioning, that is mental status, coping strategies or style, if pertinent to clinical diagnosis. Number 3. Which one is not an assessment in the problem-solving approach to social work practice? A. Focus first on identifying the problem and the aspects of the person or environment that can be involved in problem solving. B. Include a statement of the problem, objective facts and subjective responses to them, precipitating factors, and prior efforts to resolve it. C. Determine if there is an appropriate match between presenting problem and available services. D. Assess motivation, capacity, and opportunity (MCO) of the client to resolve the problem. The answer is C. Determine if there is an appropriate match between presenting problem and available services. Explanation. Assessment in the problem-solving approach to social work practice includes identification of the problems and the personal or environmental features related to problem solving, conduction of evaluation on motivation, capacity, and opportunity (MCO) of the client to resolve the problem, statement of the problem including objective facts and subjective responses, precipitating factors, and prior efforts to resolve it, conduction of a combined activity of worker and client. Number 4. The assessment process in the crisis intervention approach is concerned with the following: A. Cognitive therapy practice approach. B. Mapping how the problem influences the client's life and relationships. C. Mapping the influence of the person or family in the life of the problem. D. Presenting problem and client's resources for resolving it. The answer is A. Cognitive therapy practice approach. Explanation. Assessment process in the crisis intervention approach is concerned with investigating the stress-producing event or situation, the individual's response to it, and responses to past crises; exploring characteristic signs, phases, patterns of adaptation and maladaptation to crisis, PTSD; focusing on assessment that emphasizes current state of functioning, internal and environmental supports and deficits. Number 5. The client's negative automatic thoughts and dysfunctional beliefs should be listed during the assessment process in what approach? A. Task-centered practice approach. B. Family systems theory approach. C. Narrative therapy practice approach. D. Cognitive therapy practice approach. The answer is D. Cognitive therapy practice approach. Explanation. During cognitive therapy practice approach, these issues are to be listed: client's cognitive distortions, for example, catastrophizing, minimizing, negative predictions, mind reading, overgeneralization, personalization; client's negative automatic thoughts and dysfunctional beliefs. Number 6. In the systems theory practice approach, do problems belong to the individual? A. Yes. B. No. The answer is B. No. Explanation. During the assessment in the systems theory practice approach, problems do not belong to the individual, but instead belong to the interaction of the behaviors or social conditions that create disequilibrium. Number 7. In the family systems theory approach, a worker creates a mutually satisfactory contract with the family to establish service boundaries. A. True. B. False. The answer is A. True. Explanation. Treatment planning in family systems theory approach. In order to establish service boundaries, worker has to create a mutually satisfactory contract with the family. Number 8. Mapping how the problem influences the client's life and relationships is the assessment in what approach? A. Cognitive therapy practice approach. B. Narrative therapy practice approach. C. Family systems theory approach. D. Task-centered practice approach. The answer is B. Narrative therapy practice approach. Explanation. The assessment in the narrative therapy practice approach includes mapping how the client's life and relationships affected by the problems. Mapping how the life of the problem affected by the person or family, that is, clients start to see themselves as authors or co-authors of their own stories. Number 9. Narrative therapy builds on seeking weaknesses and deficits, rather than strengths and abilities of families and individuals. A. True. B. False. The answer is B. False. Explanation. The foundation of treatment planning of narrative therapy. Strengths and capabilities of families and individuals rather than weaknesses and deficits. Number 10. When treating children, assessment seeks to understand the child's inner feelings and conflicts, not environmental problems. A. True. B. False. The answer is B. False. Explanation. Assessment seeks to understand simultaneously the child's emotions and complex, the parent and child interaction, the family dynamics and interactions, practical difficulties, and environmental problems. Number 11. Assessment in geriatric social work is concerned with what? A. Home safety. B. Parent and child interaction. C. Adaptive behavior. D. Family dynamic. The answer is A. Home safety. Explanation. Assessment in geriatric social is pertained to problem and client's abilities to resolve it, history of generations' resources and its relation to and impact on present functioning when adults and children are involved, chronic illness and its effects in relation to physical or cognitive limitations, home safety, medications and its side effects on functioning, requirement for medical services or care. ADL, activities of daily living, for example, bathing, dressing, etc., and IADL, instrumental activities of daily living, e.g., cooking, driving. Number 12. Is treatment planning in geriatric social work concerned with building relationship through management of concrete problems? A. Yes. B. No. The answer is B. No. Explanation. Treatment planning in geriatric social work includes interventions and solutions proposing choice and supporting the highest level of functioning of older adult and independence promotion. Number 13. What is the assessment for trauma-based social work practice? A. Determine if there is a match between the problem and available services. B. Map how the problem influences the client's life and relationships. C. Evaluate if client is still at risk and if practical protective measures are required. D. Present problem and client's resources for resolving it. The answer is C. Evaluate if client is still at risk and if practical protective measures are required. Explanation. The assessment for trauma-based social work practice includes assessment for PTSD, if client remains at risk, evaluate need for self-protective measures. And assessment for domestic violence, if client is still at risk and if practical protective measures are required. Number 14. What of the following is one step in the assessment process in clinical practice? A. Determine if there is a match between the problem and available services. B. Map how the problem influences the client's life and relationships. C. Evaluate if client is still at risk and if practical protective measures are required. D. Present problem and client's resources for resolving it. The answer is A. Determine if there is a match between the problem and available services. Explanation. The assessment process in clinical practice is determine the presenting problem. Find out possible match between the problem and available services. Collect continuing data and reassess to understand clients' problems. Ask and observe behavior or effect, and organize data to create a meaningful psychosocial or diagnostic assessment. Conduct interview with associates to get sources of data other than client. And give clinical diagnosis, including relevant medical illnesses or physical conditions and its effects in terms of emotions and functions. Number 15. Does the DSM discuss causation? A. Yes. B. No. The answer is B. No. Explanation. The DSM-5 concerns with mental disorders classification and system classification with periodic revisions, including details of the symptoms, manifestations of mental disorders and associated information such as prevalence. It does not discuss causation, etiology. Number 16. Are dissociative disorders included in the major DSM classifications? A. Yes. B. No. The answer is A. Yes. Explanation. Major DSM classifications include neurodevelopmental disorders, schizophrenia spectrum and other psychotic disorders, bipolar and related disorders, depressive disorders, anxiety disorders, obsessive-compulsive and related disorders, trauma and stressor-related disorders, dissociative disorders, somatic symptom and related disorders, feeding and eating disorders, and elimination disorders. Number 17. Medication-induced movement disorders are not included in the major DSM classifications. A. True. B. False. The answer is B. False. Explanation. Major DSM classifications include sleep-wake disorders, sexual dysfunctions, gender dysphoria, disruptive, impulse control, and conduct disorders, substance-related and addictive disorders, neurocognitive disorders, personality disorders, paraphilic disorders, other mental disorders, medication-induced movement disorders, other conditions that may be a focus of clinical attention. Number 18. Intellectual disabilities are what disorders? A. Depressive disorders. B. Dissociative disorders. C. Neurocognitive disorders. D. Neurodevelopmental disorders. The answer is D. Neurodevelopmental disorders. Explanation. Intellectual disabilities are neurodevelopmental disorders in which patients suffer from cognitive capacity deficit and adaptive functioning deficit. The wording of intellectual disability changed to intellectual disability by DSM-5 is to align more closely with other groups in terms of medical, educational, and advocacy. Number 19. Does autism spectrum disorder have a social and communication deficits? A. Yes. B. No. The answer is A. Yes. Explanation. According to DSM-5, two of the defining characteristics of autism spectrum disorder are social and communication deficits. Number 20. What does a patient with neurodevelopmental disorders level 1 require? A. Support. B. Substantial support. C. Very substantial support. The answer is A. Support. Explanation. Autism spectrum disorder or ASD refers to 4 disorders, namely autistic disorder, Asperger's disorder, childhood integrative disorder, and pervasive developmental disorder. All of these disorders can be categorized in terms of severity, in which level 1 requires support, level 2 requires substantial support, level 3 requires very substantial support. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.